welcome back to my YouTube channel again. Here we discuss all things health, wellness, and just life in general. Today I'm so excited. You know, I'm always excited every time we're here. Today I have with me the Lions Aid's Executive Director. His name is Mr. Nicolas Mutale. And I also have this one is, forgive me, it's quite a mouthful, but I'll try my best. Let me read it. Ophthalmologist, basically an eye doctor specialist, but we'll get her to just tell us that in a moment. Her name is Dr Mulubwa Serenje, and I'm so excited to have them here. We'll be talking about a recent mission that they held to Mumbwa, where they did quite a number of eye surgeries. So yeah, let's learn about the eyes. Thank you so much for being here. I know how busy you are, and for taking time to come here and teach us about the eyes and how we can take care of it and demystify some of the things. It's exciting, and I'm so grateful that you're here once again. I had a hard time, as you could tell, pronouncing your job, your title. So kindly just take us through, firstly with that pronunciation, and then what it is, so we could start from there.
Okay. Thank you so much for having me. I'm also excited to be here. You're not alone, don't worry. I'm sure the majority of the people watching will also have a hard time pronouncing that word.
Mm-hmm.
So an ophthalmologist is simply an eye specialist, an eye doctor. So first you have to be a doctor, and then you specialize further in the eye. So that's when you become an ophthalmologist. So that's what I am.
Okay.
Yes.
One day I was just I spend quite a lot of time on social media because of my job. So, and now I do a lot of health reporting. I came across some pictures of that mission you had to Mumbwa and all the surgeries you did. Is it for cataracts or something?
Yes.
Yeah, could you tell us a bit about that, because it really touched my heart.
Okay.
Yeah.
So that was what we call an eye camp. It was a 1-week camp in Mumbwa. What we mean by camp is that I don't work from Mumbwa, I work from here in Lusaka, but myself and a team of other people who are involved in eye care, we went there for a week, and our main purpose was to do some cataract surgeries there. Yes, so we identified a number of people who had cataracts. Most of them have had these cataracts for a long time, just waiting for someone to give them some assistance. We identified them, and those who were eligible, we did the surgeries on them. Yes, eligible meaning not everyone who has a cataract needs to be operated on right away. We have to wait for the cataracts to reach a certain stage before we can operate on it. Yes, so there were a number of people who had cataracts, but we didn't operate on them because they were not yet ready for surgery. So out of about 120 people that we were able to screen, about 52, we identified about 52 that required surgery. Yes.
So it's quite a common condition?
Yes, it's quite common, especially in the elderly. So here in Zambia, we don't routinely collect information about the total number of people who have these conditions. But there was a study that was done in 2017 in Southern Province. About 3,000 plus people were involved in the study, and they found that about 3% of those people had some form of eye condition or another which was causing them not to see properly. And the most common condition, actually, almost half of those people, the reason for their blindness was a cataract. Yes. Okay. So a cataract, if I may explain a little bit, it's people call it a kansanga in local language, or a kavali. Yes, it's a white opacity that you see in the center of the eye. When I look at your eyes, I'm not supposed to see anything white from where I'm sitting, but people are able to identify someone who's got a cataract because when they look into their eyes, they see something white right in the center. Yes, mostly this occurs in people over the age of 50. It's age related, but it can also be caused by other things. So that's why you find that most of our patients are over the age of 50. Yes, but we also have a few who are less than 50 years old.
Yeah. And what are those other things which might cause it, apart from the age factor?
So apart from age, the other predisposing factors are other conditions in the body, like diabetes. People who got diabetes tend to have cataracts earlier than other people. It could also be caused by an injury. Some people have injured themselves, maybe they hit into something or someone threw something into their eye. The eye looks fine for a while, but later on they end up developing this cataract. Yes, some people are born with it, so right from birth they have this cataract, or they develop it in the younger age for reasons unknown. Sometimes the reason is unknown. Yes, so there are a lot of different causes, but I think those are the main common ones.
So you mentioned earlier something which I found quite intriguing, that you can have a cataract, but to be eligible for surgery, it has to reach a certain stage. Could you just maybe explain that a little more?
Okay, so a cataract, if I may use a piece of glass as an example. So we all have a natural sort of piece of glass in our eye, which you are not able to see, but if you use our examination equipment, we are able to see this natural glass, if I may put it like that. The actual word is a lens. So like what you're wearing there, you're wearing lenses. Yes, so even in our eye there is a lens. So when this lens becomes white, that's what we call a cataract. But the whitening takes some time. Initially it's just a little bit white, then it becomes more and more white until it's completely white and you're not able to, light is not able to pass through it. Yes, so when it's in the early stages, it's just a little bit white. People are still able to see, they're able to drive, they're able to go about their business. So there's no need to stress them by taking them to surgery. Most of them will recover with just a pair of glasses. Yes, but it reaches a point where the lens becomes very white and no light can pass through whatsoever. The person can see that you've switched on a light in the room, but they'll not be able to see anything else. Then it has reached like the end of the road, so to speak. Yes, so there are different points at which you may intervene depending on the country and the type of surgery that you're going to use. So here in Zambia, we tend to operate on them when they are very, very white. Yes, but in other countries, even when they are not all that white, they're still able to operate on them because of the equipment that is available out there. Yes. So we also have that equipment here in Zambia that's able to operate on an immature cataract, but those are found in specialized hospitals like UTH or private hospitals or Kitwe Central Hospital, places like that. So in an outreach setting where you just go with an operating microscope and you're using a manual method of removing the cataract, it has to be really mature so that if everything goes well, the vision will improve. And if things don't go well, you wouldn't have worsened that person's life in any way. They would just remain the way they were before.
But how are usually when you do the operations, what would you say is the percentage of those who are then able to see after that against those who maybe
so
fails?
It's over 95%, yes. But it's very much dependent on the experience of the surgeon who's doing the surgery. Yes, so the World Health Organization, that's WHO, recommends that of all the surgeries that you perform, at least 80% should be able to, like the vision should improve to a level where they're very happy with their vision. Yes. And maybe another 60%, 70% or so should be able to improve, but not to a level where they are very, very happy, but much better than it was before. And then 5 to 10%, I expected not to improve much. Yeah, because of either a complication of the surgery, or maybe they had an underlying condition whereby even if you remove the cataract, they still have something else going on, and so their vision will not improve. Yes. So I would say roughly about 90-95%.
Okay, that's amazing. And on that note, I'll ask, I know in our communities, when people see you have a certain condition, or your daughter or your son, they always come up with all sorts of remedies. These white things. I'm sure you've heard a lot of such stories about white people.
The things that they come across. So I find that others are encouraged to go and see the traditional doctors. Maybe they can give them a certain drug to dissolve the white thing. Or some of them will actually come to the hospital, but they're expecting you to give them a certain drug, just some eye drops or something to take by mouth to take the cataract away. But there's no way the cataract can just disappear from the eye. You know, it has to be removed and then replaced with something else that is clear. Yes, so we've come across a lot of myths as we are traveling in these rural areas. It's quite interesting.
Yeah.
Yes.
Could you share a bit of those, because it's important to talk about them, because some people, when they see, like for example, we all know how experienced you are in this field, so if they don't hear from you, they'll think as if, oh, someone else did it, so I can also do it. So I think we need to sort of demystify it. What stories have you come across?
So some people think that by putting sugar in the eye, that will somehow take away the cataract, sugar or salt. Some people believe traditional medicine. Others believe that there's no hope for it. Once you have it, then that's it. It can never be cured, so you just have to live with the condition. Yes. So even when people come for these camps, the people who are in rural areas and they come for screening, they come with different expectations. Others are expecting you to tell them, no, there's no hope for your eye. Others are expecting you to just give them some eye drop. And others are expecting that the moment you touch them, you're going to make a big cut into their eye and you're going to just damage it forever. Things like that. So just this past week, actually, it doesn't even have to be someone in the rural area. I did a surgery on a young man who, the day after surgery, after the bandage was removed and everything, he took his phone and took a picture of his eye, because he was thinking there must be some cuts all over his eye. So he was really shocked when he was taking a picture of himself and his eye looked okay. Yes, so that one, I found that one quite funny, because he confessed himself that the things I was thinking of, I was really thinking that I've got big sores on my eye, you know, but it doesn't have to be that painful and that excruciating.
Okay, that's interesting. And then you also mentioned earlier that when you screened about 120 people, you found 52 with the condition. Of these, how many were eligible for surgery and how many did you get to operate on?
So the 52, those are the eligible ones.
Okay.
Yes, meaning that their cataracts had advanced to a stage where they needed surgery. Yes, but there were also others, maybe about 20 or so, who actually had the cataracts, but they were not mature yet. Okay. Yes. So those ones, we told them to come and check again, maybe after 6 months to a year. Yes, because the progression of cataracts is also it's very much personalized. Your rate of progression may be different from your neighbor's rate of progression. Yes, so we check every 6 months to a year to see if it has advanced to a stage where it needs to be operated on. And when I say 52, we count eyes. So if there are 2 people who have 2 eyes that need to be operated on, to us we count that as 4. Okay. Yes. So out of these 52 eyes, the number of patients was about 45 or so.
Okay, the
Yes.
ones you actually operated on.
Yes.
So it's quite an easy procedure, would you say?
No, I wouldn't say easy.
Or
Because
maybe
you
let me
see,
rephrase that.
It takes about 2 to 3 years when you are in school and learning this procedure. The first year you do some not first year of school, maybe the second year of school, because ophthalmology is a 4-year program. You take 4 years to specialize in it. So when you're in second year, you start to learn a few steps, but you don't get to finish the whole surgery. In third year, maybe you are now able to finish the surgery, and then by fourth year, you need to reach a level where you've done quite a number, such that you even encountered those that are a bit complicated, and you can handle the complications. So roughly about 3 years to just get a hang of it and be able to operate independently. But once you get a hang of it, it becomes a quick procedure. So when you're starting out, you can take anywhere from 1 hour to 1 hour 30 minutes just on one person.
Okay.
But when you become very highly experienced, people take anywhere from 5 to 10 minutes on one patient. Yes.
Okay,
so
how long do you take?
I take about 30 to 45 minutes.
Okay, that's great.
Yes.
Yeah.
Provided there are no complications. Yes.
Yeah. And how long, is there like a long healing process after someone has undergone the surgery?
Okay, so we say that the eye has completely healed in about 4 to 6 weeks. So to be on the safe side here in our environment, we say 6 weeks.
Yeah.
Yes, so that, but within a week, the patient is not in pain anymore. They experience a little bit of pain on the day of surgery and the day after surgery, but we give them painkillers to avoid that pain. So in the first week while they are recovering, they'll be able to know that there is a sore in the eye. They'll feel it. Okay, but after a week, they are pretty much pain-free. Yes, they are able to go back to their almost normal vision, but we give it up to 6 weeks for it to completely heal. So within that 6 weeks, we ask them to take a few precautions like avoiding lifting heavy objects, avoiding any sort of strain that may injure the eye, because you see, when we remove the cataract, we replace it with an artificial lens. When you remove the natural lens, you have to replace it with an artificial one, otherwise the eye will not function well. Yes, so because it's an artificial one, you need to be careful and give it time to settle well within the eye. Yes, so within those 6 weeks, we ask them to avoid any form of heavy lifting and things like that.
So once you put that particular lens, does one need to replace it, or they can have it for the rest of their lives?
They can have it for the rest of their lives. Yes.
Okay.
They will actually be in a much better position than someone with their natural lens, because the natural lens, you know that come rain, come sunshine. With age, it's going to become white. It's a natural phenomenon. Yes. So, but once we put an artificial one, it's plastic or glass or something of that sort. There are many different types. But I mean, plastic can last forever without the need for replacement. Yes, as long as you keep your eye well, you don't expose yourself to any form of injury that needs it to be replaced. It can stay.
Okay. Now maybe let's also briefly speak about eye health in general. How can we all take care of our eyes?
So that is a very broad question.
Yeah.
It's a very broad question. So maybe I may approach it in terms of diet and just general things that you should not do to the eyes, and also health-seeking behavior. Maybe I may approach it from those three.
Those are amazing.
So in terms of diet, just a normal healthy diet is good for the eyes, especially things that are high in vitamin A, like carrots, and also things like green leafy vegetables. Those help with the so-called antioxidants. I don't want to go into scientific terms a lot, but those just help to reduce things that cause disease in the eye. So carrots, green leafy vegetables, tomatoes, all those things that are high in vitamin A. Yes, because the eye is very much dependent on vitamin A for its good functioning. Vitamin C also is good for the eyes. So the fruits that contain vitamin C, those are good for the eyes. It's not like people have to go the extra mile now and start buying a lot of oranges, a lot of carrots. As long as they're part of your normal diet, you're good. And of course, there are those people who special cases like the diabetics. They have to go a step further and follow their strict diabetic diet, which every diabetic should have been informed of their diet. Probably by the time they're getting to have eye problems, the primary physician should have informed them how they're supposed to modify their diet. Just a healthy diet, you know, avoiding fatty things and things that are considered junk foods, you know. So for the diabetics, they have to go that extra mile. Exercise as well. Yeah, lifestyle, that's pro-health in short. Yes. Then the other thing is health-seeking behavior, in the sense that every person needs to have at least one eye checkup in their lifetime. Okay, whether you feel your eyes have issues or they don't have any issues, just have an eye checkup at least once. Because there are certain diseases that you can only find on examination. You look normal for 10, 15 years. By the time you're coming to see the doctor, the disease has reached an advanced stage. And some of these diseases, there's nothing much you can do once you catch them at a later stage. Yes, so at least once in a lifetime, someone should have their eyes checked. And then, depending on what is found by the person who has examined them, they'll be given another review, or they'll be told, for you, you're okay, just go and live your life taking care of your eyes. Yes. So health-seeking behavior, that's the second one. The third one, so you're not supposed to put anything in the eyes, nothing at all. The things that are out there, like if you feel there's an itch, you can put sugar or salt. No, simply don't put anything in the eyes. If you're having an itch, you're better off even washing your face with cold water than to put anything in the eyes. So do not put anything unless it has been prescribed by someone who is at least who's got a bit of knowledge concerning the eye. And this, I may even caution those who like going to pharmacies and buying over-the-counter drugs. A lot of times we encounter patients who come with self-made problems because they've used the wrong drug in the eye. Because eye drops look the same, but there are many different types of eye drops. There are eye drops for different types of conditions. So now if you put an eye drop which is going to cause damage in one way or another, like raising the pressure or making your immunity weak and exposing you to diseases, you know, you're just putting yourself at risk for no good reason. If at all you feel you have an issue with your eye, it's itchy, it's painful, you're better off going to see an optometrist. These shops where they sell glasses and things like that, there's usually someone who can check your eyes there. If not, you go to the local clinic. At the local clinic there, whatever they're not able to manage, they will refer you to someone who is specialized in eye care. Yes. So apart from just not putting anything in the eyes, even water. I've heard people saying when they feel like there's something in the eye, it's better to wash it with water. It's not advisable to put water because tap water is not clean, you know, unless it's a situation where something like acid or something of that sort has gone into your eye. Before you go to the hospital, there you're allowed to put some water in the eye. But for anything else, just don't put anything unless you visit an eye specialist. Yes. Then The other thing that you're not supposed to do is to assume that because your sister, your brother went to the hospital and they were given this medication, even you, when you feel like you've got an eye problem, you simply get their medication. That is an absolute no, because things may look the same, you may have the same symptoms, you may have the same complaints, but your diagnoses are very different. So you find that you are using a wrong drug for your condition and you're not improving simply because you've gotten the wrong thing. So you're not supposed to do that. Another thing I wanted to mention is this upcoming, there are two upcoming epidemics when we talk of the eye. One is something called computer vision syndrome, because we are spending so much time on the computer in this generation, the millennials, always on the computer and always on the phone. Yes. So what is advisable is to not spend so much time staring at the screen for long periods of time. We understand that some people's jobs depend on the computer, so they can't avoid it. But a good health habit is to just take breaks. Every 20-30 minutes, take your eyes off the screen, just look at something far away for a few seconds and then come back and continue with your work. That gives the eyes time to blink and to distribute the tears that are in the eye. Yes, so just something as that simple. Okay, then you avoid this computer vision syndrome. Most people will come with things like, I always have a headache later on in the day, or my eyes feel very dry, they start tearing up. It's simply because you're not giving your eyes time to blink and to distribute the tears while you're spending the time on that screen. So just something as simple as taking your eyes off the screen, that will help. Then the other thing is short-sightedness. It's also becoming a global problem.
Okay.
Because we are spending so much time with our gadgets and our eyes are always, you know. So the brain adapts. It starts to think that, oh, for me, I just need to see things that are nearby. And so the eyes become short-sighted. What that means is that you are able to see near very clearly, but when you want to look far away, it's a problem for you because your eyes have gotten used to seeing things that are near. So especially our younger generation, it's advised to just let them play the way we used to play in our day. I'm not that old, but you know, when I was young, we used to play a lot outside as compared
back
to...
Back then, there were not many TV. Even me, I'm not like that old, but I know what you mean.
These days, even when it's shocking, you go for a kids' party, instead of them playing with each other, they want to play gadgets and tablets and things like that. That is the generation that we are living in. So just spend more time outside doing outdoor things, because when you're doing outdoor things, your eyes are forced to look at things that are far away. Yeah, it doesn't have to be for the whole day, and it doesn't mean that you restrict the children from playing on their tablets and what have you, but make a balance. Balance the playing on the tablets with the outdoor play. Yes, so those are the two that I thought I should mention.
Okay. And every time I get an opportunity to speak with someone so knowledgeable, I never end the interview without asking them a few questions like, how did you get into this field? What drove you there? You know, what keeps you going?
So, to be honest, I didn't grow up thinking, oh, I want to be an eye specialist, I want to be an eye specialist. This came about after I finished my doctoral training, and I needed to specialize in something. I'm a wife, I'm a mother. I had to think of a course that will enable me to spend as much time with my family. So when the options were floated before me, there was surgery, there was this same eye specialist, there was specializing in ears and things like that. But for me personally, I didn't want any course that would be making me spend nights in the hospital, like surgery or obstetrics, where at any time they call you. But I wanted something that involves surgery, will give me time to spend with my family, and it is also challenging. So when somebody mentioned the idea of ophthalmology, I went and did some research about it, and I was intrigued by the technology that is around ophthalmology. ophthalmology. So when I read about it, I thought, wow, this is something I can try. I also thought about the ears, but then the problem was that at that time there was no training offered here in Zambia. So that's how that one went out the window. Yes, so ophthalmology became my strongest option. And I thought, let me just give it a try and see what happens in this same ophthalmology. And I really thought that it's not all that involving. Boy, was I wrong. Just from first year, it's so involving because it encompasses so many other disciplines. Yeah. Yes, and I understand why you have to train as a doctor first before you specialize. It looks like a small eye, but there's complex. It's very complicated. Yes. So that's how I found myself in ophthalmology. But the way I've come to love ophthalmology, I wouldn't want to trade it for anything else. Like if I had to choose what specialty to do, I would choose it all over again. Yeah. I love the fact that when you operate on someone, the very next day you're able to see the results. Yeah, I love surgery because of that one factor whereby you operate and the result is almost instant. Yeah, as opposed to like the other disciplines of medicine where you are treating the same condition year after year, year after year, you are managing it. For me, I don't find that very interesting, but in this field, I like the surgical part. I like the fact that it's so high tech. The technology that's involved here is unmatched. It's very interesting.
Oh, now I feel like I want to go to med school. Okay, thank you so much. I don't know if you have anything to say in closing or anything else you might want to add.
So in closing, I just want to reiterate the fact that a lot of the eye conditions that people are living with in their homes are treatable. You know, they are either treatable by surgery or just by simple use of eye drops, but you will never know unless you have your eyes checked. So I'm just encouraging everyone who is listening or watching, take some time to just visit an eye specialist and have your eyes checked. You just never know what you're saving yourself from.
Yeah. Thank you so much once again. We hope you'll be here if we invite you again.
No problem.
Thank you. Hi friends, thank you for watching up to here. I've inserted these images. These are some of the beneficiaries of the outreach that the Lions Aid Zambia had to Mulubwa, and these are some of the people who benefited from the surgeries. So continue now the conversation with the executive director to tell us more about their work. Thank you so much for being here and agreeing to just have a chat with me. I saw some of the work you did recently in Mulubwa, all those surgeries that you have funded. Could you tell us just briefly some of the work that you do here?
Yeah. Maybe to start with, I could probably introduce who Lions Aid Zambia is.
Yes.
We're an NGO incorporated here in Zambia under the NGO Act of 2009. We're a public benefit institution, so this is approved by the Zambian government. And most importantly, we are owned by the Lions. I'm not sure if you've heard about the Lions. So
yes.
the Lions is a volunteer that you see around. These are friendly Lions, of course, not the ones from the parks and so on. Yeah, so we're owned by the Lions, and our mandate as Lions in Zambia is basically to design projects, implement long-term impactful, humanitarian service activities here in Zambia. That's who we are as Lions in Zambia. We've been around for a number of years now, supporting various projects. You may know that Lions have had a flagship program over the years of their existence. The institution itself as Lions, the Lions volunteer side, or what we call Lions Clubs International, has been in existence for over 100 years. And one of those flagship programs has been prevention of blindness. And of course, for those that already have blindness, treatment, and for those that whose blindness can't be reversed, we support rehabilitation so that they can be easily integrated in the society and they could positively contribute within their communities, and of course at a larger scale this country, as Zambia in this case. So we have a number of programs that we've been supporting, and at iHealth, we've been supporting a project in Mutale province, covering 8 districts of Mutale province. We just started this year in 2023, supporting a project in Central Province. And the pictures that you saw most recently were from a district called Mumbwa, where we have, of course, we are working very close with the Ministry of Health, where the team from the Ministry of Health were in Mumbwa district conducting eye surgeries. So these projects, in the case of the Central Province project, it covers over 7 districts. We are now rolling out the second additional funding. We're committing an additional $100,000 in Central Province that will cover the districts that were not covered in the initial project. And these districts include Chitambo District, Serenje District, Ngabwe District, Kabini-Poshi District. So the 2 projects put together, Lions Clubs International are committing over $700,000 over the next 2 years to support these interventions and some of the outputs from the projects that we are training human resource to specialize in eye health. We're providing equipment and instruments, drugs to enable the doctors themselves to be able to provide a service. And of course, all these services are being provided at no cost at all.
Wow, that's amazing. And let me tell you a bit of a story about how I came to know about the Lions Club and whatnot. So back in high school, there was a club called Leo. I'm sure you know about it, like in the schools. So I joined it, and I was so excited because I loved everything we were discussing. And I remember going home and telling people, "Oh, I'm a Leo. I'm going to get inducted and whatnot." And I feel like because of the word induction, they were like, "No, those are Satanists."
No, that was far from it. Far from it.
Far from it. I feel. What do you think causes such misconceptions?
To be honest, I don't know. I don't have a bullet answer to that question. But I'll tell you that in my personal capacity, I've been a member of Lions. I belong to a club called Lions Club of Roma. And all we do is to serve, to help those that may be, less fortunate as we are. That's what Lions do, and nothing else.
And it's amazing. It's amazing.
It's a nice journey. Please come and join us. We want as many people to come along on this journey to help out the next, the next individual out there who may not be as privileged as we are. So
I don't know if there's anything else you'd like to add.
So in addition, of course, to IELTS projects that we are supporting as Lions in Zambia, we do other projects. We realize that it's not only eye that people may be in need of. It's about access to clean water, as an example, access to general health. Ensuring that we have health facilities as close as to the as possible to the people and the communities themselves. So not long ago, we recently handed over to the Ministry of Health 2 health facilities. One built in Mumbwa, in a place called Kayumuyuma, and the other built in Rufunza, in a place called Chamulimba. So we not only concentrate on eye health, but we also support other areas of need for for the communities that we serve. That's from the health side, but also from education perspective, we also supporting activities around ensuring that communities have access to equitable education. As an example, in Kayumuyuma, where we recently handed over the health facility, we built a school there, and we are now in the process to support, of course, in this case, Ministry of Education, to expand facilities there by building additional staff houses. And we're looking forward to also construct, things like dormitories, so that the children could have access to food. And all these projects that we do within the community are largely driven by the demand from the community itself. Because we also want them to participate in the process and also ensure that these facilities are sustainable over a long time. So they are what I would call gatekeepers, so to say, of these facilities. So we built these facilities. And if you go there 2, 3, 4 years, 5 years down the line, there's still in very, very good state. There's no vandalism. So we ensure that whatever we do is something that is at the center of the need of this community, and the community itself is part and parcel of the entire process. So these are some of the other projects that we are supporting in Zambia, and of course it's our intention to continue to do so many years to come.
Yes, and I hope I'm so grateful that you were so open enough to invite me so we can have a chat, and with the doctor as well. And I'm so open to like getting on board with any other programs that you have related to health, especially. I am happy to write about them, so I hope your door will be open.
Yeah, definitely. We will definitely invite you. If, oftentimes you are available, we could actually invite you to come and go and experience what the doctor was talking about in terms of the transformation of some of these individuals or some of these patients from this particular day when they're not able to see to the next day when the bandage is removed and they're able to see, and they express their pleasure, their happiness, and so on. So we're definitely open. You could come to any time, and I think through our team here, we'll definitely reach out to you when those opportunities exist, so that you could come along and come and see for yourself. And that would also tell you what actually Lions do. In action, and not just about what we speak, what we're saying, what we're actually doing, but what you'll be able to see physically yourself with your own eyes. Yes.
Okay, thank you so much.
Thank you very much for coming, and of course our doors are open, like I said, anytime.
Thank you. Thank you so much for watching, and I hope you learned one or two things. I definitely did. See you next time, and please don't forget to share, because sharing is caring.